Today we are going to talk about Newcastle disease in chickens, and why this is one of the most important viral diseases in poultry medicine. Newcastle disease is a highly contagious disease caused by Newcastle disease virus, also called avian paramyxovirus type 1. The important thing to understand is that not every strain behaves the same. Some strains are mild and mainly cause respiratory disease, while virulent strains can move through a flock quickly and cause severe respiratory, gastrointestinal, neurologic, and reproductive disease. The virus usually enters through inhalation or ingestion, especially from respiratory secretions, feces, contaminated equipment, clothing, feed, water, or contact with infected birds. Once it reaches the respiratory or intestinal tract, it begins replicating in epithelial cells. With more virulent strains, the virus can enter the bloodstream and spread systemically, which is when Newcastle becomes more than just a chicken with respiratory signs. Pathogenesis depends heavily on viral virulence and tissue tropism. In the respiratory tract, the virus damages mucosal surfaces, causing coughing, sneezing, gasping, and nasal discharge. In the gastrointestinal tract, it can damage intestinal tissue and cause green watery diarrhea. In severe cases, vascular injury and necrosis can lead to hemorrhages in the proventriculus, intestines, and lymphoid tissues. When the virus reaches the nervous system, chickens may develop tremors, twisted necks, paralysis, circling, or incoordination. In laying hens, systemic illness and reproductive tract involvement can cause a sudden drop in egg production, thin-shelled eggs, misshapen eggs, or complete cessation of laying. Prevention is the real treatment for Newcastle disease because there is no specific antiviral cure. Good biosecurity means quarantining new birds, limiting visitors, cleaning equipment, controlling wild bird exposure, and not sharing cages, crates, or feeders between flocks. Vaccination is also critical in many poultry systems. Live vaccines such as B1 or Lasoda are commonly used to stimulate mucosal and flock immunity, while killed vaccines may be used for longer-lasting protection, especially in breeders or layers. Treatment is the frustrating part because once a chicken is infected, we are mostly supporting the bird rather than directly killing the virus. Supportive care can include warmth, fluids, electrolytes, easy access to feed and water, and reducing stress. Antibiotics do not kill Newcastle disease virus, but they may be considered if secondary bacterial infections are complicating the case. If virulent Newcastle disease is suspected, the number one response is not reaching for a medication. The priority is rapid isolation, reporting to animal health authorities, movement control, and flock-level disease control, because waiting too long can allow the virus to spread through the premises and beyond. The big takeaway is that Newcastle disease is not just a chicken with respiratory signs. It is a contagious paramyxovirus disease that can damage the respiratory tract, GI tract, nervous system, and reproductive system. The best control is prevention through vaccination, strict biosecurity, and fast recognition, because once virulent Newcastle disease is suspected, the most important treatment is outbreak control before it becomes a flock-wide emergency.